Now, Florida's taking heat on all sides for how it's reporting virus data, and there's a lot of confusion over what that data is really showing. Well, the maps and charts we're about to show you should help you see what's really going on. Dr. Jason Salemi is an epidemiologist at USF who mapped it out on Tableau, that software that helps people see and understand data. Well, as schools plan to reopen, let's start with a closer look at how COVID-19 appears to be affecting school-age kids here in Florida.
Right now, as I look at the age-specific trends in the numbers of cases that are being reported on a daily basis, they continue to go up for every age group, including our school-age population.
The green line represents pediatric cases in Florida, the red line, senior citizens.
The pediatric population, this green line, was always way below everybody else, but as we've progressed over time, actually they're almost dead on top of each other of the elderly.
Now let's move on to infection rates in Florida relative to population. Well, the areas in red show zip codes where 1 out of 50 or more than 1 out of 50 people who live there have already tested positive. South Pinellas County is in the red right now. Tracking south, we also have red zones in the Bradenton area. Then to the east in the Wimauma zip code. And then heading north into Hillsborough County, we see similar rates in North Tampa, Town and Country, Carrollwood, and Lutz. Then tracking east, we see another red zone in Lakeland and East Polk County. Now let's move from infection rates to case fatality rates. On this map, the counties in green have lower fatality rates among those who tested positive, higher rates in orange and red. We see the rates are a little lower in Hillsborough County than Pinellas County, and then higher heading south into Manatee and Sarasota, and among the highest in the state south of Sarasota in Charlotte County. Then among the lowest in the state through the Orlando area in Orange County.
Those counties that have an older age of the cases are much more likely to experience higher case fatalities.
But keep in mind, when it comes to fatalities, there is a big lag in reporting. The state's COVID dashboard shows when deaths were reported to the state and not when they occurred.
Even after the point at which they passed away, we've seen that the lag in death reporting has been anywhere from a few days to a few weeks.
Changing the chart from when deaths were reported to when they occurred changes the trend. It shows deaths began to pick up in mid-June, a couple of weeks after cases and positivity rates started rising after Memorial Day. And then the downward jog you see at the end of the chart means that the numbers are incomplete again due to the lag in reporting deaths. Okay, now let's take a look at the positivity rate because, of course, that's a key indicator of whether the virus is receding or resurging. We see it dropping through April, then up and down in May, and then increasing in June and appearing to peak last week. This indicates accelerating community transmission since the Phase 2 reopening on June 5th. Then the curve started bending down the past few days. But again, big disclaimer here, the data again is running behind. There's a lag, not as much perhaps as deaths, but still enough to cause issues in interpreting the data, especially as labs continue to run behind on processing tests.
Even though we had a bunch of new tests that may be reported or new cases that came out on a given day, when those cases were actually positive, could have been a day, back in the past, it could have been 1 to 2 weeks before.
So while the positivity rates show slight progress, we could have already made more progress that'll show up later in the data. Or after people mix together on July 4th weekend, we could have already faced some setbacks and don't know it yet. Either way, here's a closer look at how the volume of tests relates to the scale of the outbreak.
It's how many tests do we have to perform before somebody tests positive?
Now you want this number to rise because that indicates progress in mitigating the virus. We made significant progress going up in May, peaking at 30 tests per positive case, and then we've been backsliding through June. Tests per positive case have leveled off the past few days and now will hopefully start to go back up. And that brings us now to issues and controversies with what the state is reporting. We'll start with hospitalizations. The state is reporting hospital data for COVID-19 patients, but it is only counting patients who were coded with COVID-19 as a primary diagnosis. That means it's likely undercounting the true number of COVID patients, and here's one of the reasons why.
If a pregnant woman comes into the hospital and it's because of COVID-19, the COVID-19 diagnosis does not end up being the primary. It's a secondary because the coders are supposed to assign a pregnancy-related diagnosis as the primary. So what I can tell you, if people are actually following the CDC guidance for coding, all pregnant women who come into the hospital, even if it's because of COVID-19, they're not showing up in the current hospitalization numbers.
Meanwhile, people who go to the hospital for other issues and happen to test positive for COVID-19 also do not show up in the state stats for COVID hospital admissions.
And what I've heard from clinicians who are actually managing this is, it doesn't matter why you came in. If you have COVID-19, that complicates the hospitalization that much more. It's using much more PPE. It's taking much more resources from the hospitals.
There are also problems with how the state has been reporting the positivity rate. Our sister station in Orlando, Fox 35, first reported some labs have only been reporting positive results. Barring other factors, that could make the positivity rate look higher than it really is.
I don't think they were trying to be underhanded.
The state chalked it up as a small number of labs that it has since told to report all results. But while that could have inflated the positivity rate, epidemiologists say Florida is doing other things in the stats that can make the positivity rate look lower than it truly is. For example, when someone tests positive and then gets tested again and again, if the follow-up tests are positive, the state will not count them in the results. But if they're negative, the state will count them in the results. Given the possibility of getting reinfected in basic math, that could artificially deflate the positivity rate. And epidemiologists like Dr. Salemi have also flagged the state's reporting for a different reason, because it includes antigen tests known for being less accurate. It's all created a situation in which the state's numbers could be inflated due to one variable or deflated due to another, and watchdogs say either way it could erode public trust. And that's why we continue to dig into the numbers to show you where we have blind spots and why we have them and what the data collectively is showing and how we can visualize it, because we are now facing challenges far greater than money, power, and politics.